last decade, implantology has become an indispensable part of mainstream dentistry, helping dentists to improve the quality of life of large patient populations. The phenomenon of osseointegration of implants was discovered in 1952 by a Swedish orthopedic surgeon, Professor Brännmark. He defined osseointegration as a direct structural and functional connection between ordered living bone and the surface of a load-carrying implant. It's believed that Brännmark's work constituted the birth of the era of evidence-based dentistry. In recent years, there has been a vast amount of research and development in implant design, geometry, materials, and techniques with the objective of further improving success of implant treatment. So, how much do you really know about dental implants? Let's start with the basics. Modern implants consist of an osseous part that interacts with the bone, a transmucosal component that interacts with the mucosa, and then the restoration, such as a crown, bridge, or denture. Implants usually made from commercially pure titanium, titanium alloys, or occasionally ceramic materials. They are generally threaded, but can have many different design variations. So, what if you see a patient for an assessment and you find they have a dental implant? What are you actually supposed to check? Firstly, it's good to make a note of the oral hygiene, as well as the tone, colour, and texture of the peri-implant tissues. You can then gently squeeze the tissues to assess bleeding and exudate. The current literature suggests that gentle probing should be carried out routinely to screen for pathology. Probing depths may differ around implants due to the depth that the implant has been placed. Probing must be recorded at every recall interval from a reproducible reference point. If any inflammation is present, a radiograph is recommended to evaluate any bone loss. 2 mm of bone loss is acceptable in the first year, and 0.2 mm each year after. PeriImplant disease includes both peri-implant mucositis and peri-implantitis. Peri-implant mucositis is a reversible inflammatory reaction in the soft root tissue surrounding a functional implant. Peri-implantitis is inflammatory reactions associated with loss of surrounding bone around an implant in function. PeriImplant disease is unarguably one of the most significant risks associated with implants. It's a multifactorial disease, and if not diagnosed at an early stage, it can ultimately lead to failure of the implant. Comprehensive treatment of peri-implant disease remains an enigma, but is largely dependent on the underlying etiology at play. The first phase of treatment usually involves the control of acute infection and the reduction of inflammation. This involves the removal of plaque deposits and improved patient compliance with oral hygiene. Many further treatment lines have been suggested. As more and more implants are being placed by clinicians of varying skill levels and clinical backgrounds, the number of patients presenting with this disease appears to be on the rise. So, what training do you need before you start placing implants? A number of dental boards and dental councils around the world have expressed their concern that dentists sometimes get involved with implant procedures without having sufficient knowledge, understanding, training, and experience to undertake these procedures safely and to an acceptable standard. Furthermore, this allegation often features in negligence claims as an alleged breach of dentists' duties of care. Of particular concern is a short course that is promoted and conducted by those companies and individuals who have a direct commercial interest. It's incumbent upon the practitioner to ensure that they are aware and comply with the requirements of their dental board or dental council about the minimum level of training required to practice implant dentistry. Always remember that successful implant surgery is largely dependent upon the skills and judgment of the clinician. In particular, case selection, good treatment planning, and meticulous technique.